Ovarian cysts are bags of fluids that occur on the ovaries, either inside or on the surface of the ovaries. And generally they vary from a small size, something that could be as small as even 1 centimeter, or they can grow quite big to something even bigger than 10 centimeters. And generally they tend to be quite innocent, but we can also have varieties that could be what we call malignant or cancerous. There are 2 types of ovarian cysts. I would start with the first one. We call them physiological cysts. So these are cysts that they occur through the natural body processes. For example, through the process of ovulation or during pregnancy in the early stages, you can also have cysts that occur naturally to support the pregnancy. And these ones, most of the time, they're quite innocent and you don't have to worry about them unless they undergo some changes that you're going to talk about later. And then the second category is pathological cysts. These are cysts that have problems, or they can cause significant problems in the body. And you can have examples such as something called endometriomas, which are cysts that occur in people who have endometriosis, a condition that causes severe pain during menses, or generally having very severe pain in your pelvis. And then we also have cysts that occur through infectious processes. For example, if you have pelvic inflammatory diseases where you have pus forming in your pelvic areas, you can have it forming pockets of pus there, what you call ovarian abscesses or masses. And then we also have a category of abnormal cysts called cancers, and these ones can vary from age and also from the type of cells that they occur in the ovary. So they can range from quite a variety. I'm not going to go into the details of that because it will make this whole thing very complicated. I think it's very natural to worry if you have cancer. For example, if you've been told you have an ovarian cyst, the main question or the main worry will be, is it cancerous? Should I worry about this? Should I be operated on or not? So there are some of the things that we doctors use to help us understand what kind of a cyst you have. And as already mentioned, there are types of cysts that we call physiological and others that we consider pathological or things that we worry about more. So we use some of these characterization to help us understand exactly what is happening, what kind of cysts you could be having, and whether we need to take any further action. Generally, most ovarian cysts are quite innocent, so most of them are not cancerous. In fact, quite a small percentage of them will end up having a cancer diagnosis. And some of the things that can help us understand whether it could be a cancer or not, the findings that we find on an ultrasound scanning. So when you do an imaging, one of the important things that we ask for is an ultrasound scan, a simple scan of your tummy. And we look for certain characteristics of the cysts. For example, if there are 2 of them occurring in both ovaries, or some changes that are happening in the cysts themselves, or if they're causing fluid accumulation in your tummy. So we consider all these factors to help us understand what kind of risk in terms of cancer having or a cancerous process going on in your body, you stand a risk at. And then we also do some tests that include doing a blood test that we look for molecules called tumor markers that also help us to understand whether the kind of cyst you have is something worrisome or it's not something worrisome. And sometimes we also consider age and also whether you have undergone menopause or not. So there are many things that can give us an idea of whether or not what you have could be something to worry about or not. But generally, the reassurance is that most of them are quite innocent and you don't have to worry about them too much. But you have to talk to your doctor about this. Symptoms of ovarian cysts. So ovarian cysts can vary from what we call asymptomatic, meaning that it doesn't give you any symptoms at all. You might not even notice they are there. You might not even know they're there until, for example, you go for a checkup and they do an ultrasound scan and then they find that you have a cyst, or you go for something else, for example, a pregnancy, and then voila, you're told you have a cyst. So it can be quite asymptomatic, or it can cause symptoms. Some of the common symptoms that can happen is feeling fullness in your pelvic area, or sometimes pain. It can also lead to that, or sometimes even causing your tummy to swell up, because if they're very large, they can cause your belly to grow large as well. In certain situations, if it undergoes some changes, what we call torsion, or if it bursts and bleeds in itself, what we call rupture or hemorrhagic cyst, it can lead to severe pain, and that pain can sometimes even make you feel nauseated. It can even make you throw up, or sometimes it can travel down your bums or even your thighs. And it usually starts quite suddenly and is quite severe, that sometimes you may have to go to the doctor to be. Yes, and sometimes if it's a cyst that is coming from, for example, a cancerous process, it can also cause problems like feeling too full, having loss of appetite, feeling bloated, and sometimes also having a lot of weight loss because the changes that come with the cancerous process. Okay, so concerning investigations of ovarian cysts, as I said initially, sometimes you may happen upon a cyst when you are totally coming for something else at the hospital, or we are being investigated for something else, for example, a wellness checkup, and then we just happen upon it, what we call incidental finding. But then in the event that you have symptoms and you're suspicious of it, one of the important things that we have to do is an ultrasound scanning. And this is just a picture that we use at the hospital to try and look on your tummy and see whether you have a cyst or not. Quite simple, quite safe, it doesn't have any radiation. And then sometimes if there is any concerning features from that, you may have more images being done, for example, a CT scan or even an MRI to be done to help us understand the cyst a bit more, or even further characteristics around it. And then secondly, we may also need to do blood tests to check for what we call tumor markers. So these are some molecules that are produced by your body, and they're produced by certain tumors. Different tumors may produce different types of these molecules. So when we check your blood, it helps us to understand, are these tumor markers present, and if they're there, which ones are they? They help us understand what's going on and how we can approach your care as well. Sometimes it may also help to do some infection tests. For example, if you're suspecting you have an infection or a cyst that is an abscess, or it has a pus inside, what we call tubovarian abscess, you may need to do some infectious tests to check for sexually transmitted infections, because they're the ones that are sort of linked to that type of cyst happening. Sometimes you may also do a pregnancy test, because you may have a cyst occurring when you're pregnant as well. So those are some of the basic tests that might be required by your doctor to be done when we are suspecting you have a cyst, or when we confirm that you have a cyst. On management of ovarian cysts, this one depends on a lot of factors. One of the factors is first of all, whether they are giving you any symptoms or not. If they're not causing any problems on you, and generally they look safe, they don't look like they are cancer, and the size is small, we can just do what we call conservative management, or what we call watchful waiting, where we just monitor the cyst size over a few months. And for most of the ones that we mentioned as physiological cysts, they tend to go away naturally without any intervention. But then we also consider the symptoms that they give you. For example, if it has undergone the twisting that I mentioned, what we call torsion, or if you have bled and you suspect that maybe the bleeding is a bit too significant, sometimes you may require to be operated on to try and sort out that issue. It also depends on what we suspect in terms of whether it's a tumor, or it's a cancer, or it's not a cancer. And that one, we consider a few things that I had already mentioned earlier, like the tumor markers and what we find on the imaging. And with that, sometimes we may need to escalate the care even further to our colleagues who are experts in cancer, and we do much more than what you would think. For example, if you didn't have any worry for cancer, for example, you might require surgery, you might require even chemotherapy or radiotherapy, depending on what kind of, for example, cancer you have. And then for people, for example, who have a cyst that has infection, for example, the tubovarian abscess, sometimes you may need antibiotics, or if the cyst is too big or it doesn't go away with antibiotics, you may also require surgery as well. And the same goes for endometriomas. The ones that I mentioned, they occur because of the process of endometriosis. So if you have symptoms, you may need sometimes to be operated on to get rid of the cysts, or sometimes you may need to be on some hormone therapy, what we commonly use for endometriosis management, or painkillers to try and help you cope with the symptoms as well. But generally, the other factor that we consider highly is the size of the cysts. So we use a measurement of about 5 centimeters. So cysts that are generally smaller than that, safer to observe, even especially the physiological ones. But then if they're larger than 5 centimeters, they are very prone to twisting or rupturing. And for those ones, generally, we may recommend surgery, even if it's a simple cyst that is there. So there are many things that we look at, and we put all these things into perspectives. We discuss this with you so that you understand what's going on and why we're making the kind of decisions or recommendations